let's talk about the Affordable Care Act itself. And if we looked ahead beyond today's headlines, do you have can you explain to us how this is supposed to transform?
Well, I think there are little pieces of it that we can identify now. There are certainly differences in finances, the issue of the medical cost ratio, how much of an insurance company's dollars has to go into the actual payment for health care as opposed to administrative costs. There are things that we hope will change, like increased access for care. There has been some downward pressure on healthcare costs in the past year. We don't know the reason for that. There's speculation that it has to do with the economy and lower demand for services.
We're also seeing some layoffs in
We're
healthcare, and we don't
definitely-
know exactly the cause and effect of that either. Right?
We don't. And the layoffs that we're seeing, for the most part, are hospital-based layoffs, and that's often out of concern because of the position we're in Missouri, where hospitals are losing their disproportionate share payments. And we're expecting to recover from that through an expansion of Medicaid. And because we don't have that, we're going to have a lot more uninsured people who are going to continue to need care.
I would agree with all of that. The one thing I can think of to add is that we're going to see more primary care shifting to clinics, and you'll see pharmacists following up with the patient more. Also, nurses will be doing more primary care. More people are going to start carrying responsibility.
Yeah, I remember asking the question a while ago, how is this going to impact the pressure on the primary care system or the availability? And the answer is, well, we already have problems with that.
We do, and it's likely to get worse in the short term. With increased coverage, there is likely to be increased demand for care. And I completely agree with Tara that we're going to have allied health professionals taking on a new role, but we're going to have to continue to train larger numbers of those individuals.
And maybe change some
to
of
be
the rules
qualified.
Yes.
Definitely.
and regulations regarding
Definitely,
what
Jim.
a nurse practitioner can do
That's right.
without a doctor.
That's
let's say.
right. Midwives has been
Yeah.
such a historically controversial issue in this state. We're going to need those newly licensed individuals to help out with everyday care.